Welcome to Locally Sourced. I'm Armanda Famiglietti. Alzheimer's disease. It's the 6th leading cause of death in the United States and the 5th leading cause of death for Americans 65 and older. 5.4 million Americans have Alzheimer's, 40,000 in the Hudson Valley. Alzheimer's disease is not preventable, it's not curable, and it can't be slowed. Luckily, the Alzheimer's Association is trying to change that. I'm very happy to welcome Denise Kuhbier and Venesa Marcellin from the Alzheimer's Association. Thank you for being here.
Thank you for having us.
Denise is a registered nurse and healthcare consultant. As Senior Vice President of Lean on We, an innovative home care service, she's witnessed the devastating impact of Alzheimer's has on families. And before joining Alzheimer's Association, Venesa worked for the New York City Park and Recreations and managed the second largest recreation center in Manhattan. She has a bachelor's and a master's degree in sports management. So Venesa, what does the Alzheimer's Association do?
For us at the Alzheimer's Association, our mission is to eliminate Alzheimer's disease. We want to be at the forefront of ending this devastating disease. While we're on that quest, we provide care and support for those suffering and their family members that are going through this.
Can you give us a little more information? For example, I went on the website, which is terrific, by the way, if anyone is interested in any
incredible
aspect
resource, absolutely,
of Alzheimer's. It mentioned that you support research.
Absolutely.
Can you
Definitely. So the Alzheimer's Association is actually the leading nonprofit when it comes to Alzheimer's research, and we're third in Alzheimer's research, and we're only third to the Chinese government and the U.S. government. So in terms of nonprofits doing research, we're leading that charge. And we do that by the funds that we raise through our walk, which I know we'll talk a little bit about later on. But we want, as I mentioned, we want to be on the forefront of finding that cure. So we consistently fund research projects all around the country and beyond, actually.
So it's a national organization, and there's a Hudson Valley chapter. So
Sure.
Tell me a little bit about what the Hudson Valley chapter does.
Absolutely. So locally here in the Hudson Valley, we represent the 7 counties north of New York City. So from Westchester to Sullivan, as north as Sullivan County.
Okay. So above New York.
Right above New York, Westchester, and then all the way north to Sullivan County. Denise and I represent Putnam County, and what we do, I manage the Putnam County Walk to End Alzheimer's. She supports me in that endeavor, but we represent those 7 counties. And so locally, we have care consultations. And so care consultations are opportunities with our licensed master's level social workers that sit down with the families, sometimes in their home, oftentimes in their home, Denise, I know you can attest to that, and counsel folks through what they're going through when they, maybe initial diagnosis or during the journey of having this disease.
When you say counsel folks, are you talking about the patient, the person who's been diagnosed, as well as their family members? And do you want to?
I mean, it could be. It's really the family,
right?
Okay.
Because the illness is so devastating that people really don't know what the journey is going to be like, and so a care consultant that comes out from the Alzheimer's Association can really talk to them about the planning, the journey. What's going to happen in a short time, what's going to happen longer than that, how to plan financially. So all kinds of things they can help with in the counseling department with.
So a minute ago I saw something on the screen. I think it gives, it's a graphic that explains some of the different pieces of Alzheimer's, and they'll bring that up in a minute.
Sure.
But there it is. Can you tell us a little bit about that graphic?
Well, that graphic actually is something that we use. I think it comes out annually, actually. This is the 2017 one. And it's such a snapshot of how devastating this disease is. You mentioned a lot of those facts, actually, in your intro. The 6th leading cause of death. Every 66 seconds, someone in America is diagnosed with Alzheimer's disease. By 2050, it'll be every 33 seconds. So that graphic really kind of brings home what is really going on. I think sometimes when people think about Alzheimer's, I know for me, before I started working at the association, I said, oh, that's that memory thing. right? But when you start to learn and see these facts, you realize it's far beyond memory, and it is staggering. The numbers are staggering.
Okay, so let me ask you.
Sure.
You just said by 2050.
2050.
So what are the lookout for a cure? I mean, is that 2050 without a cure? That 33% of the people.
Exactly,
Right.
exactly. So that's 2050 at this pace. If no cure is found, if no advancement in research has been made, that's where we're headed, and that's every 33 seconds.
And it's devastating, right?
Right.
It's devastating to families, and unless you've been through it or been exposed to somebody with the disease, you really don't understand. Once you are exposed to people that have the illness and families who are going through this, you realize what an impact this, if we don't find a cure, what the future is going to be like.
Right.
So how close are we to finding a cure?
I think that we've made incredible advancement over the last 20 years. The association, I think, has only existed since 1980. I hope that stat is right, or that figure is right. I think it's 1980. So we've only been here about, 30 years, almost 40 years. And so I think a lot of advancement has happened in that short time to even know the warning signs of the disease, to even be able to say, no, this person is not crazy. There's plaque, there's tangles in their brain. This is what's causing this. Those advancement has been made. I know we got very close in a recent drug, so there's definitely drug trials that are taking place. Have we found a cure? No, but I believe that we are on the path to do just that, and hopefully we do it by 2050. Right?
So is Alzheimer's hereditary?
So it can go both ways, in the sense that there are genes that you can be tested for that say, I think they call it a deterministic gene, right? So if you have that, you're predisposed. You may be predisposed to Alzheimer's, but we cannot at this point say that if you have that gene, you will get Alzheimer's. Okay. So there's still a lot that we, unfortunately,
what if you
don't know.
have that gene?
You can.
You can.
You still can get Alzheimer's.
You still can get
it.
It
really doesn't mean
we
anything.
Exactly.
You don't recommend that people get genetic testing.
Well,
then.
I think knowledge is always power, right? So I think it's important if you know your grandmother and your aunt and
Right.
your uncles, if you realize that there's some, correlation in your family, it does not hurt to get tested, but it doesn't mean that you will. And if you don't have that situation in your family, doesn't mean that you will either. I think what we recommend here at the Alzheimer's Association, we say what's good for your brain is good what's good for your heart is good for your brain. So the same things in terms of exercise and eating right and staying active, those type of things are going to help your body holistically, and that's all that you're in control of, right?
So tell me about, there are warning signs, I understand, right? About 10 warning signs. Can you go through them?
So
Sure.
did you know that usually I come in after the warning signs have already began?
Sure,
So,
absolutely. So that's the 10 that we, and I don't know all 10, but some of the few. I know a few. But so the very first one that most people are familiar with is memory loss, right? But so I had a wonderful educational program when I first started here. That's a part of the services that we provide. It was by Joan Carl, who is one of our community outreach managers, and she gave a beautiful presentation. And or was it by Janet? Either way, they're both wonderful. Okay. And
you have great staff
they're
working
great,
there.
They're great. But either way, what I learned in that is that memory loss, it's not just, I got to my car, I got to the grocery store, I'm in the parking lot, I came out, I can't find my car. That's
normal.
We all do that. It's coming out of the grocery store, going to the parking lot, and not remembering where you are. Right. It's like having that moment
of how to get home.
Yeah, or how to get home and what's going on. It's not just tripping up on your words and what's that word. It's not being able to recall while you're even having those sentences flow, right? That's where it becomes a warning sign. And I think people oftentimes they might think, oh my goodness, this might be Alzheimer's. No, we all forget what to say here and there, but it's when it becomes a little bit more drastic is when you might want to
Right.
take it a little bit more seriously.
All right. Is it important, if you feel like you have some of these warning signs, to get help? Is it going to make a difference?
Absolutely.
What would you suggest?
I usually tell clients that call to go to their primary care physician and get a workup, because there's other things that could mask confusion.
Absolutely.
So you could have a urinary tract infection.
Absolutely.
In fact,
You could be dehydrated.
you could be
right?
dehydrated. And so the first thing is to get a baseline evaluation and make sure there's nothing medically going on. And then to be able to get some support, get support from the Alzheimer's Association, get support from your doctor, get support from the local community. There's programs available to keep you stimulated during these times.
Okay, so the first step would be your primary physician.
Absolutely.
When do you contact the Alzheimer's Association? And do you go there in person? Or I know you have so many, you have a message board, you have ways for caretakers to connect with each other on the website. You have information about the latest research. So what is the entry point for the person once they have a diagnosis of Alzheimer's?
It's, I think first and foremost, it's whatever you're most comfortable with initially, because sometimes people might feel more comfortable just going online and seeing what information is out there. Right. However, once you've reached the point where you want to come into our office, we have 5 offices throughout the Hudson Valley, but I will say that we have a 24-hour helpline. So even if it's 2 a.m., you can call 1-800-272-3900.
What's the nearest office to Carmel?
The nearest office to Carmel, I guess it depends on which direction you would like to go. If you'd like to go further north, it's Poughkeepsie to Jefferson Plaza. If you would like to go south, it's our White Plains office in Purchase.
So it's about 35 minutes away either way.
Either way.
Right, but I think it's important to know that they'll come to your home.
Absolutely.
If a client or
who's coming to your home?
the social worker will come to
Okay, so you employ social workers and then you send them out to people who've contacted you.
Correct.
Yes.
Correct.
These are the care consultants that I was referring to earlier, are staffed in our office that are willing to have those care consultations in our office or out in the community.
Sometimes family members can't get to the office, or they have several other, they have children that want to learn about the disease and they want to be there. So sometimes a care consultant shows up and there's a family present.
Right. And usually these families, they're the sons and daughters of the person who's afflicted, because it's a late in life disease usually. And so they probably have their own children that they're caring for, and now they're faced with caring for their parents.
Correct.
So that's quite a shock, I'm sure. How do you advise them to deal with that?
The Alzheimer's program is fantastic for younger kids too. They have literature. They could help teenagers or younger kids understand what's going on. And I recently talked to somebody yesterday, and they had an 11-year-old, and I was saying, please call them, because they can coach you and give materials that will help your 11-year-old understand about the disease process. Because maybe they're at a different place. It's their grandparents and they don't know what's going on. So I think it's really important. There's so many resources available at the association, so I think it's a matter of just reaching out and having somebody even mail it to you.
Right.
If you don't want them to come to your house yet, or you don't want to go to their office, have them mail them.
It's good to know what to expect with Alzheimer's, because it affects people different ways. I know just from the folks I've known who have it, sometimes they can be angry. They can be violent. And that's kind of surprising to family members, I think, that they're behaving in a way they've never seen their grandparents behave or their parents behave before, and that must be quite shocking. So you help the caretakers prepare for this kind of strange behavior, or what would appear to them to be out of character behavior.
Yeah, I think so. Being in the healthcare profession for many years, that's, for me, was the most important part of my job, was to educate the families. And they were so disappointed that their family member was not the same person that they knew. So coaching them and acknowledging that it's really, they can't help it, it's nothing that they're doing, don't worry about it, don't feel bad, and really helping them. Because I think in some ways you help the families more than you actually help the client at one part.
So as I understand it, usually Alzheimer's is broken up into 3 stages, first, middle, and end. Can you describe a little bit what's expected in those stages?
So I would say it's initial, middle, and end stages. I would say the initial stages is the warning. You start to see warning signs. You forget where you put your keys. You forget where you parked your car. You forget to shut the stove off. You forget why you were going somewhere. Little things. As it progresses and it becomes more of a moderate, you have more symptoms that, maybe your ADLs, activities of daily living, like bathing, dressing, grooming, are starting to change. You're not taking care of yourself. You're not eating properly. You might have forgotten that you didn't eat, or you might have eaten and an hour later you're eating again because you forgot that you just ate. So it's really all kinds of different things that happen in the moderate stages, and you start to forget who people are in your life.
That's in the middle stage.
Yeah, it depends. You know, the stages are so hard to delineate. Right. And when you're moving,
it's different for each individual.
It is absolutely
right?
different for each individual. End stages are towards the end when recognizing people is very difficult. Maybe your physical symptoms have started to change, and your mobility, the ability to remember how to walk or to swallow or things like that, is what happens really in the end stages.
So even some things that seem to be part of the automatic nervous system, like swallowing, you can forget to do.
Yes,
absolutely.
Yes, which is a very devastating piece towards the end when a family member forgets how to swallow and may choke or aspirate. But it's really tough.
Wow, and there's no treatment for that. There's just palliative care at that point.
Right, palliative care, or towards the end of life, hospice services could be put in place.
I would think that at those end stages it becomes very difficult for the families to take care of their family members. What should they do in those cases? Should they bring in full-time care? Should they send them to some kind of a facility that knows how to work with people in that stage?
I think it's a choice. It's a choice for the family, what they're capable of doing, how many family members are willing to participate, and if you have the financial resources available to be able to pay for the care in the home. Really, it's all different things. Sometimes I recommend an assisted living, sometimes I'll recommend a nursing home, sometimes I'll recommend staying home with full-time care. It depends on the situation and what the client themselves wished for most of their lives.
Okay, so it's important to decide, if you do get Alzheimer's, to decide how you'd like to be treated before you actually get Alzheimer's, because at the time you have it, you may not be able to make decisions rationally. Mm-hmm. So tell your loved ones that if I do have dementia or Alzheimer's, this is what I want. Make a plan in advance. That's a good idea?
I think planning in advance is good for anything.
Yeah, for any aspect of growing older,
yes.
right?
Exactly.
Yeah, it's much easier for the family to be able to carry out the plan if the conversation happened ahead of time.
Right.
Exactly.
Right, and everyone is clear on what the wishes are.
Exactly.
Okay, that's great.
Exactly.
So we talked a little bit about expenses. Mm-hmm. So it's very expensive, it sounds like, for the families if they don't have enough health insurance or whatever. What about long-term care? Does that help with Alzheimer's?
If you have purchased long-term care insurance previously in your life, it will help. Medicare really doesn't pay for custodial care, is what it's called, when you need a companion. If you don't have the resources available, you could do Medicaid planning. So there's options out there, and the best thing would be to seek out an elder care attorney to really help you to do the planning necessary so that you're prepared for the future.
Okay, so talking about Medicaid, right now there's a lot of talk about Medicaid expansion, Medicaid coming back to where it was before Obamacare. Would that affect the families of Alzheimer's patients?
Of course.
Absolutely.
Of course. Right now, Medicaid pays for services. Community Medicaid will pay for services where someone can stay home with a caregiver in their house, and Medicaid will pay for it. Also, if you're in an institution and you can't afford to pay for the institution, like a nursing home, Medicaid will pay for that.
Okay.
But if
is that under Obamacare or is that under Trump care?
It's a state program.
Okay, so it's going to
offered.
stay the same no matter what happens in Washington. Is that what you're saying?
Not exactly. They're always trying to make cuts to the Medicaid system because we utilize the services more than most states do. So it may, in fact, that number of hours may be cut and things like that. So clients that are on Medicaid right now are very nervous about what happens if the cuts go into place. Where are they going to be left with? How are they going to care for their loved ones?
Okay, so it could be
Yes,
very bad
unfortunately.
if the actual,
Yes.
the present bill, and who knows what's going to happen with that bill, goes forward and is voted into law.
Correct.
Yeah, that's what I've been hearing. It's very frightening. So tell me about how Alzheimer's Association funds itself. You both are involved with the walk. Tell me about the walk.
Absolutely. So we are funded through grants. We have a lot of state grants. Actually, very, very thankful in the New York State. We're one of the chapters that do have those grants that came through, I think, a couple years ago. But another way we do that is through our constituent events, and the walk is one of those events, one of those fundraising events. And we do that here in Putnam County in Carmel. It's at, this year it's in actually a new location. It's at Putnam County Veterans Memorial Park for the first time this year, and it's coming up on October 15th. And for us, it's our largest fundraiser, not only locally in the Hudson Valley chapter, but nationwide.
So does everyone walk in the nation on October 15th? Is that how it
No,
goes?
there are various so there are various walks happening throughout the fall. So we try to have them right after Labor Day, not right after, but after Labor Day, and then kind of before November, throughout
before the weather change.
Throughout the nation. So you might see a lot of purple throughout the nation for about a month.
Oh, great. I love purple.
Nice.
That's your color.
That's our color. So you might see a lot of that. And that's done on purpose. Obviously, you want to have the most impact at once. So throughout that month, few weeks, you might see a lot of purple.
I think it's also important to understand that most of the people that help to kick off the walks and everything, they're volunteers. I'm a volunteer. And
you're the chair of the walk here in Putnam.
I am the chair of the walk here in Putnam, and I'm a volunteer, and so is most of the team. Vanessa's the only employee, and then everybody volunteers. There's so many people that are committed to ending Alzheimer's that they devote their free time to help with the illness.
So was last year the first time that we had a walk in Putnam? I think we have some photographs.
Oh, that's awesome.
Yep.
So the walk has been happening in Putnam for quite a while now, but we took over, I guess, a couple years ago. Denise, I think this is your third year.
Yep. Okay.
This is my second year.
So here we have some folks.
Wonderful. That's awesome.
Now that's interesting because I'm going to make the assumption maybe that the woman in the wheelchair is an Alzheimer's
that could
patient
be somebody
and the
that's suffering
family's
from
there.
disease. Yeah.
Okay, so purple and white.
Yes.
And how many people come out for this?
For our walk, about 500 people.
That is fantastic.
For our walk in Putnam County, but we have 5 walks throughout our chapter territory, and at our Westchester event, we get about 1,600 people. So it's definitely a showstopper for us.
That is fantastic. So is the Westchester and the Putnam event on the same day, or
no?
So you could go to both.
You could go to both. You could go to both. You could go to all 5.
Duchess, is there one in Poughkeepsie as
there's
well?
one right over the walkway.
Okay.
On October 14th.
So say I want to walk.
Yes.
What do I do?
If you want to walk and you're not sure which walk, the best website for you is hudsonvalleywalks.org. Or you can call my cell. Can I give my cell?
Yeah, in fact, it's going to be on television.
Oh, well, there you go. 845-394-4952. You can give me a call and I can sign you up with whatever walk you're interested in. If you're specifically interested in the Putnam event, that's putnamwalk.org.
Okay, that's terrific.
Yes.
And what are you going to lead the walk? What is your duty at the walk?
My duty is to make sure the walk is successful. People come out and have a good time. We're going to try and make it like a carnival and have some fun things for kids. And
this is all at the Veterans Park on October 15th.
October 15th.
Yes. During the day, what time?
It starts, the walk kicks off at 9 a.m.
9 a.m., yep.
Okay.
And
we'll probably be there earlier than that,
yes.
getting ready, but the walk kicks off at
that.
9, and then when you're done walking, you can hang around, talk to the vendors that are there, go in the Jumpy Castle, have popcorn.
Oh,
yeah,
great.
Yeah.
I love the Jumpy Castle. That's terrific.
You know, the walk for us is, yes, as I mentioned, it's our signature fundraising event, but it's also phenomenal for awareness for us. That See a Purple means something, raising awareness like this show right now to let people know that, yes, Alzheimer's is devastating. Yes, this is something that we need to start talking about. And the walk helps us to facilitate that conversation in a way that we're celebrating. We're calling to mind what's going on, but we're also definitely celebrating.
Well, I can't wait till there's a cure, and then we'll all celebrate.
Absolutely.
A lot. There'll be a lot more people out at the walk. So how much do you expect to raise at the walk? And
we have a goal.
We're hoping, can I say that? We're hoping for $100,000 this year.
Excellent. And that's
County.
just in Putnam County. You know what? The people in Putnam County are very generous.
Yeah.
And they really come out when they're needed.
Yeah.
There are other walks, and I see people out all the time. Yeah. So you can count on Putnam County. Yep. I'm sure you can.
Absolutely. We did about $70,000 last year, and that was the most we've done ever. Right? So, and Denise for sure is definitely hitting the pavement in Putnam County, so we're hoping to get there very
Denise
close.
and Venesa. That is
Yeah.
fantastic.
Yes.
So I hope you will come back on when we get closer to the date
we would
of
love to.
October 15th, and you
Yes.
can tell us how the registration for the walk is going.
That'd be great.
It's been fantastic to have both of
Thank
you
you so
here.
much.
You and I have been talking about this for
Yeah.
a while, and now it's happened.
I'm glad that it happened.
So I just want to say
Sure.
that we're pretty much out of time. See,
All
it
right.
does go pretty
It
fast.
does go
doesn't
by.
it?
She's right.
So thank you both
Thank
you
you
for having
very
Thank
much
you.
for the work you do. And thank you so much for volunteering
Absolutely.
and for working with the Alzheimer's Association. If people want to go to the website, it's alz.org.
Yep, it's alz.org /Hudson Valley if you're looking for the local resources.
Okay, but there's plenty just on
Oh, of course.
alz.org. You
Right.
can spend a lot of
Absolutely.
time on that website. And tell me again about your contact information. People want to register and walk in Putnam and all the other Hudson Valley walks.
Sure. So if you're looking for a walk throughout our chapter territory, HudsonValleyWalks.org. For Putnam specific, PutnamWalk.org. And my contact information if you just want to reach out and say hello, 845-394-4950.
Well, you're very friendly, Vanessa, so I would
about the
encourage
Healy's
people to
event?
do that.
We also have an event if you'd like to join us at Healy's, which is
Oh, that's a restaurant.
Yes, it's in Carmel. It's going to be on August 16th. Thank you for bringing that up. It's on August 16th, and it's our big kickoff event. So that's something
Okay.
that people, if they want to hear more about the walk,
Is that the
that's a
place with
great
the
one.
really good hamburgers?
maybe,
hamburgers,
but
maybe.
we have there's free food and there's a live
Yes.
band.
Free food and a live band.
Come out.
August
16th.
August
at
16th.
7
That is
at 6 p.m.,
fantastic.
I'm sorry, 6 p.m.
Okay, so we have to wind up.
Sure.
Thanks so much again.
Thank you.
And as usual, I want to thank our very talented volunteer crew here at Locally Sauced. Thank you. Till next time.